This is Balázs Moldoványi, CEO of PCS, and today I'm going to talk to you about a vision for the future of simulation. So thanks a lot for joining us. Excited to share with you this somewhat unusual vision for the future of simulation based on what we have learned about state-of-the-art technologies at PCS over the years. First, let's step back and let's look at what is simulation in general, not limiting ourselves to just healthcare simulation. According to Wikipedia, simulation is an approximate imitation of the operation of a process or system that represents its operation over time. That's very academic sounding and very generic. So let's see how we can use that definition to understand how we use simulation across various fields. Simulation is used to test what-if scenarios of complex engineering systems, from power plants to spaceships, to optimize the performance of manufacturing processes like a plastics plant or an oil refinery, to help design and develop systems like nuclear weapons that cannot be tested any other way. And finally, more important and more relevant to our topic today, simulation is also used to train humans to perform better in complex situations as a result of low risk and more accessible practice. So unlike in most of the engineering-oriented simulations, the goal in healthcare simulation is typically not to learn something about the system that we simulate, which is the patient. For the moment, let's just ignore the use of simulation in drug development and let's focus on the traditional definition of healthcare simulation, when our primary objective with simulation is training humans. That is going to be important as we try to envision the future of simulation. So that's why it was important to clarify that we are focusing on the training aspects of simulation. So, knowing that our objective is training, we want to provide better training via simulation. So if we know that we are training better, that by definition means that we are simulating better. By looking at how we can make sure we train better, we can see the future of simulation in a utopian prediction. But what does it mean to train better? Well, that's easy. We need to optimize training for the improvement of patient outcomes relative to the resources used to deliver that training. However, this is a rather difficult to measure metric because patient outcomes are so far separated from the training, both in time and in terms of level of interactions. So we often need to fall back to a more directly measurable metric on the quality of training we provide, one that's based on learner performance assessment. This is still challenging to define. After all, there are many ways to measure learner performance, but it is still a useful as a more measurable metric with a more direct feedback loop to our training activities. Okay, so when we design training, we optimize and compromise across multiple dimensions of that training. Since our resources are limited, the efficiency of the training delivered is a key element in evaluating how good our optimization is. Our resource constraints force us to pick what dimensions of simulation we choose to improve first. We shall choose based on how efficient these dimensions are in generating better outcomes. No matter how much we would like to use unlimited resources to eliminate all medical error and train perfect future healthcare professionals, that's just not a realistic approach. So we have to choose how we allocate our resources as we improve simulation. This choice is yours, and this is what defines the future of simulation. Choose wisely. Sure, but choose between what? Let's see at least some of the menu. The traditional view of simulation is that you just cannot make it realistic enough. Here we are talking about perceived realism, the elements of the simulation that we sense very directly with sight, sounds, and touch. Basically, this is how realistic the simulation looks, sounds, and feels to the touch. Of course, we expect to see an improvement of this perceived realism over the further development of simulation. That's not a hard prediction to make. But when we consider the future of simulation, we tend to focus too much on perceived realism, and other dimensions of the simulation are often lost and overlooked. Yes, realism and the suspension of disbelief are critical elements of good simulation, but the situation is a little more nuanced if we consider resource allocation and efficiency. There is reason to believe that there is a good enough level of perceived realism, meaning that further increases of this realism only provide diminishing returns in educational outcomes per unit of resources used. Or, to put it another way, increasing realism beyond a certain level is probably not the most cost-effective way to further increase the educational benefits of simulation. There are many alternative dimensions for improvement beyond this perceived realism. We will talk about some of these, but let's briefly allude to a few that we're not going to address in detail today. So, for example, some other kinds of realism, like more secondary levels of realism, like the simulation of interprofessional communication, or the quality of third-party data sources of information for learners used during the simulation. Other quality metrics of the simulation are even more meta and are about the quality of the instructional design of the delivered content and the entire experience, as in how well it facilitates learning. Today, our time is limited, and we're going to analyze a single alternative dimension of simulation and its impact on the future of simulation. This dimension is going to be the quantity of simulation. Most of you would probably agree with me that your learners could gain educational benefits from more simulation contact hours than what they receive today. It is likely that there is a similar diminishing return formula here as well, just like with realism. But as in 2020, we are pretty far from this saturation point with regards to quantity. With more simulation, why more simulation is going to improve educational outcomes? Well, first of all, practice makes perfect. With more practice opportunities, learning actually qualitatively changes and transitions from understanding to something that reacts more like muscle memory. Also, an increasing variation of experiences can only be presented with more simulation hours. Experiencing the long tail of possible cases, patients, and complications in simulation, as opposed to real patients, is one of the main claimed benefits of simulations. Well, this can only be realized if we simulate more. Finally, simulation-based practice and learning are proven to be one of the most efficient ways to build learner confidence, which improves learner performance in the experience settings, but also sets them up for better further learning. So simulating more is beneficial, clearly. So let's see how this relates to the future of simulation. We're almost there. So what stops you from your simulation center to provide 10 times the contact hours you do today, to radically scale up your operations? Well, some of the challenges could be quickly mitigated with money. To get more simulators and a larger simulation center, even that, it takes some time to build up something like that, but still, that's probably solvable with resources. However, other challenges are more about the difficulty of scaling up human resources and know-how, something that is not just a monetary problem. And finally, Substantially increasing the size of an organization introduces operational overhead and increased logistical challenges. Yet, if you agree that your learners could benefit from more simulation, you should demand technology to help you accomplish that, and accomplish that in a more efficient way, i.e., within the existing constraints of resources. Is it possible? Well, that's a great challenge for technology to figure out. In some ways, actually, the last few decades has shown us that technology is actually better at this kind of challenge. For example, we have become pretty good at making video calls accessible to all, as we are experiencing right here today, as opposed to doing some crazy breakthrough like hyper-realistic holographic telepresence. Technology failed in the latter one, but it's pretty good in scaling up and making things more accessible. So let's see how this impacts the future of simulation. So what are our demands for the future of simulation? What do we need it to be so we can train better and simulate more? Today, we're going to present you a future of simulation which is more affordable, immersive, flexible, and perhaps most importantly, accessible. We're going to look into each of these qualities and how technology can help with them. But before that, here is one last note on how simulation is going to be different in addition to affordable, immersive, flexible, and accessible. We also believe that the simulation, the future of simulation is also more conscious as opposed to unconscious. Full body mannequins are traditionally pretty good at simulating an unconscious patient who doesn't talk or move. But honestly, the vast majority of real patients that future healthcare professionals are going to encounter in real life are not unconscious. So let's just keep this in mind when we evaluate future simulation technologies. With that side note, moving on along our four key qualities. Number one, affordable. This one is easy. Of course, we can simulate more with the same resources if simulation is becoming more affordable. That's no-brainer. Disruptive companies are making simulators more affordable. That's the expected trend of a maturing technology. But there is another potentially more transformative component at play here, which is artificial intelligence. For some of the functions that previously in the past required a human actor, we can now use software AIs. For example, practicing the verbal information gathering of entry-level clinical interviewing. This does not mean that AI is replacing standardized patients anytime soon. Rather, AI can help those standardized patients to focus on the most sophisticated and complex areas of their jobs while enabling scaling up simulation operations by freeing up SPs from the most mundane of their duties. Immersion helps with suspension of disbelief, and an immersive simulation can offset certain elements of lacking perceived realism. How can simulation be immersive more efficiently? One possible answer for that is virtual reality. Additionally, it is just so much easier, which means more affordable and more efficient, to make a virtual reality patient move and talk compared to the same functionality in a mannequin. So VR is going to help us make simulation more immersive as one alternative, as one option, but not as an end-to-all kind of solution. Simulation needs to be flexible. Flexible so you can develop content once and deliver it across several modalities: mannequins, screen-based, virtual reality, and wearable simulators. This is one key form of multimodal simulation. You already know that each of these modalities has different advantages and has its place in the simulationist toolbox. However, we often overlook the benefits to use several of these modalities to deliver identical or related educational objectives. Learners can prepare with a screen-based simulation for a large-scale mannequin-based exercise and then remediate in VR. And across the entire spectrum, basically learn about the same thing by being able to use the same content in all of these modalities. So that's what we mean by flexible for multimodal simulation. And finally, the future of simulation has to be more accessible. More accessible to us means self-service, learner-driven simulation, because the ultimate level of accessible simulation is when learners can use it as a resource as needed, on their own, on their schedule. This is only practical when students can experience simulations with no real-time facilitator involvement. Some forms and levels of simulation can already deliver this level of accessibility. However, more intelligent simulation platforms combined with better content can elevate this to more advanced simulation experiences. That might sound a little bit surprising, and then maybe much of a stretch. So let me add some disclaimers here. This can only happen in the near future if the know-how of the facilitator is not replaced with technology. Rather, technology enables the simulationist to simulate with more leverage, design some experiences, set up the logistics, define the learning objectives only once, and then let learners experience it on their own over and over. Learners need a truly user-friendly simulation platform because it is not their job to learn to simulate. They want to bring their own device to simulate for simplicity and ease of use. They want to be able to start and run their sessions, and they want to self-assess and practice more. This also requires a simulator that can truly speak for itself and has the necessary AI-driven abilities to understand and respond to spoken questions. If there is not a real-time human being in the background, a facilitator or anyone else, then the simulator has to do it for itself. Finally, also in the absence of the facilitator, it is the simulator's job now to present realistic physiological reactions to drugs and treatments in case we want to simulate just beyond the diagnosis and not only the initial clinical interviewing process. All these coming together to summarize it all, the story of healthcare simulation really has just begun because it's just a long process and we're all at early stages. But the next chapter is only going to happen if you continue to innovate and demand innovation from your partners. You can enable better learning through simulation, and some of the ways to get there are through making simulation more affordable, more immersive, more flexible, and more accessible. The toolset of technology today and tomorrow can give you all that and then some. By using simulation platforms combining the best of current AI, VR, cloud technologies, you can deliver better multimodal and learner-driven experiences to scale up simulation to the next level. So the future looks exciting. But what is even more exciting is that the future, or at least some part of it, is already here and happening today, just not everywhere. At PCS, the last 5 years, we have been working hard to accelerate the progress of this future of simulation and to realize this vision. We would like to show you how far we have come. And with that, allow me to hand it over to Nick Stoic, the VP of Sales at PCS.
All right. Thank you, Balazs. So yeah, as Balazs mentioned, my name is Nick Stoic, VP of Sales for PCS. And to reiterate what Balazs just said, we really do believe that the future of simulation is affordability, immersiveness, flexibility, and accessibility. And now what I'd like to do is demonstrate how we believe the PCS Cloud platform fits into this future, starting in the Sim Lab. So next to me here, I have Alex, which is our simulator-based mannequin. And he is a traditional simulator in the sense that you're able to check his pulses, you're able to listen to his heart sounds, his lung sounds, his bowel sounds, that sort of thing, check his blood pressure, everything that you would expect from a modern day patient simulator. But what's unique about Alex is that he can do two very important things. The first of which is he has the PCS speech communication engine built in. So as a learner, I'm able to speak with him, and then he's able to respond back with scenario-specific responses. And as part of that communication engine, and as part of the PCS Cloud, he can be entirely self-driven, or learner-driven, I should say, if the faculty decides to share access with me. So right now, I will demonstrate kind of how that looks from a learner perspective. So I'm going to go ahead and share my screen here. Now, what we're looking at here, this is a computer screen, obviously, but for the most part, a learner will be able to use their mobile device, log into the PCS Cloud, and see the simulators that have been shared with them. So in my case here, I see Alex 269. My teacher has shared that with me, and he's online, ready to go, and I can start my simulation session. So if I press start, immediately I see the patient case that has been assigned to me. I can go ahead and click start, and the scenario starts up. I'm able to see the vitals monitor from my phone, so I can see his heart rate, his SpO2 level, his respiratory rate, that sort of thing. All of that physiology matches up with, as you would expect, his, chest breathing, his pulse points, all of that syncs up. But of course, since this is a self-driven scenario, I can speak with him as well. So if I just tap his shoulder here, hello.
Hello, how are you?
I'm good, how are you?
I've been better.
What's going on?
My chest feels heavy and it hurts.
So you can see there, I can continue this conversation, really dive into, what's going on with his chest pain. And then afterwards, I'm able to take my stethoscope, listen to his heart, and check some other vitals before I decide on a treatment plan for my patient here. But for time's sake, what I'm going to do is I'm going to end my scenario, call it good for the day, and press the stop button. And then immediately what I'm given as a learner is an automated assessment piece to show how I did. So in this case, I didn't do very well. I got, 33%. In most schools, I imagine that would be a failing grade. So as a student, obviously I want to be able to improve and practice more, but my time in the simulation lab is up. So I have to go home and, worry about this. But with the PCS Cloud platform, we can extend a student's access to simulations, not only from the sim lab, but also from the home as well. So as a student now, let's say I've gone home for the night, I'm sitting at home and I want to do some more practice here. I also have been given access to a Spark virtual simulator from my instructors here. And on that Spark simulator, I have the same Alex Kassian case that I worked with in the simulation lab now at home, where I can practice some more and really get more confident before I go into my tests. So if I go ahead, I'll click on start here. And the first thing that I'm going to see is kind of the lifeline for Spark. This is going to show me, just kind of some basic introduction on working with a virtual patient, how to speak with them, that sort of thing. And then once I'm ready to really begin my simulation, I can come over here to the video screen, and now I see my virtual patient sitting in front of me. So I'm going to do the same thing I did in the simulation lab. I'm going to start speaking with the patient, try and diagnose what's going on, and excuse me, then I'll start with a physical exam as well. So I have this little microphone button here. I'll go ahead and click on that. Good morning.
Good morning.
What brings you in today?
My chest feels heavy and it hurts.
When did this start?
Last night must have been around 6 p.m. But it wasn't that bad, so I just went to sleep, and when I woke up it was still heavy and hurting.
If you had to rate the pain on a scale of 1 to 10, what would you rate it?
It's pretty bad, like 6 out of 10 now. When it started it was maybe a 4. I thought it might just be indigestion. But it's getting worse.
Is there anything that makes the pain better?
I don't know. I haven't tried anything.
Is there anything that makes the pain worse?
I don't know if anything makes it worse.
Okay. Have you ever had anything like this before?
I haven't had anything like this before.
Do you have a family history of heart attacks?
My father passed away, quite young I'd say, of a heart attack. He was only 55. No one saw it coming.
Okay. So as you can see here with our scenarios, really these patients are fully fleshed out characters in the sense that we can not only ask them about their history of their present illness, but also we can ask them about their past medical history. We can ask them about their family history, if they have any kids, if their parents are still alive. We can ask them about their risk factors, such as, do they drink, do they smoke, that sort of thing. All of which, the patients will be able to respond with accordingly. And to give you a sense of how much the PCS communication engine is able to understand, thanks to machine learning, we're constantly adding more questions that our digital patients are able to understand. And right now, we're getting close to 30,000 different questions that a patient could understand and then respond back with a scenario-specific response. So as a student, now I've kind of gone through this interview with my patient, but now I'm ready to get a closer look and actually do a physical exam and see if there's anything that I can find in that. So there's two different ways that I could initiate the physical exam. The first of which is to, say very naturally, okay, I'd like to listen to your heart now, and that will initiate the physical exam. The other way is I have this little button down here with a shirt on it. I could click on that, and then that will initiate the physical exam as well. When the physical exam is initiated, what's going to happen is the patient will undress, and then I'll have a few different icons here to choose from. The ear icon, that's going to be for auscultation. So if I wanted to listen to the patient's heart sounds, all I need to do is click on that button, and then I can actually mouse over the patient's chest, hold down, and then in this case, I'm listening to the heart sound at the pulmonic area. I'll turn the volume up. I'm not sure if you guys can hear that on your end, but I'm actually able to hear the heartbeat out of my computer's speakers, and depending on the case that I'm running, I could hear pathology in those sounds. I'm also able to listen to lung sounds as well as bowel sounds. So that is auscultation. We also have the eye icon here, and this is for kind of a visual inspection. If I wanted to get a closer look at the eyes, the ears, the nose, the mouth, all of that I could do. And the way that that works, I can just hover over. Let's see here. I can just hover over the eyes, for example, and then I would be able to get a closer look at the eyes. I think in this case, the patient might not have any findings here, so that's why the tool isn't showing up. But for example, the way that that would work is if I click on the eyes, then it gives me a closer look at the eye image itself, along with a text interpretation of what that finding is. Also, if there was like a skin condition, you could get a closer look at the rash, for example, with the eye tool. And then the hand tool here, that is for physical palpation. So you can see here a little hand shows up. So if you wanted to palpate the stomach, see if there's any findings there, you could click on the stomach and see if you have any masses or such in the stomach. But in this case, since it's a chest pain case, nothing to find there. So once the physical exam is done, the final step that I'm able to do as a student is I can choose to order labs or imaging. So if I wanted to, request blood work from the patient, and then also, a CT scan of the chest to see if we find any blockages in the heart, we can do that. And the way that works is we just have our list of available orders here. I can click on, the ones that I want, choose order selected, and then immediately I get that cardiac CT scan showing what is, going on in the heart, along with a text interpretation from the radiologist. So now as a student, I'm pretty much done with my scenario here, and I can go ahead and click the stop button. But before I do that, what I want to show you guys here is just the log. So everything that's being shown is being recorded and transcribed so that as an instructor, they're able to see what happens during the scenario. So once I click on stop here, then that is going to end and my assessment piece will show up. And you can see I've improved my score from a 33% to a 40%. So I've done slightly better, but practice makes perfect, so I can keep going. But finally, let's say I've run through a bunch of sessions here and I'm able to, now I'm ready for my OSCE exam. So how are we able to bring kind of more realism to the OSCEs with the PCS platform? And that's where PCS Plus comes in. So I'm wearing PCS Plus, which is a wearable simulator that's also connected to the PCS Cloud. And so if you put this on a standardized patient for that extremely realistic type of simulation, we're now able to combine atypical physiology as well. So the same scenario, this Alex Kassian case, could be run on a standardized patient as well, giving abnormal heart sounds along with abnormal pulse point sounds to really round out a learner's experience from going with simulators to digital patients to standardized patient-based encounters. And then from a faculty perspective, they're able to see their students' performance go from the very beginning, interacting with the patient simulator, and then how their scores improve working with the digital patients, to then finally with the standardized patients. So really the PCS Cloud platform is giving the flexibility to run the same scenario across multiple different modalities, and it's giving the accessibility for learners to drive their own patient case scenarios and their patient encounters. And then it's giving that immersiveness to bringing enhanced realism, whether it's to standardized patient encounters, whether it's through digital patients on VR, or finally having that conversation piece with a patient simulator. And then finally, on the affordability standpoint, so everything that we've shown here is priced to start under $15,000. So very affordable in that sense. So that is the kind of the demo of the PCS Cloud platform. Balazs, let me know if I missed anything, and if not, I believe we can open it up to questions.
The only thing I would like to add, if you could stop screen sharing, probably that would be better. So the only thing I would like to add is that obviously, it takes two critical elements to create this kind of portable multimodal experiences. One is a tool, and the other is a piece of content. So the platform and the content go hand to hand. And that means that both the bundled content with the PCS products is designed for multimodal use. But even more importantly, the advanced content authoring tools available as part of the PCS platform enable you to create similar multimodal ready pieces of content, patient scenarios. And we had a question, can you show a wearable simulator? So Nick, I asked you to kind of stand up and grab the stethoscope and just show a little bit more, because it's more visible now that your screen sharing is off. So yeah, this is a wearable simulator right now. Nick, he is now, the first stages of the demonstration, he was acting as a learner. Now he's acting as either a standardized patient or as a low-fidelity mannequin, which could also wear this wearable simulator. This is a smart shirt, and it looks like nothing special, and that's the whole idea. It's a tight-fitting shirt made of elastic material with all kind of location sensors in there. And if Nick is placing the stethoscope on top of that shirt, it is playing the vitals that in the form that is relevant to the particular scenario.
Yeah, and then I also have, I should mention too, I have my radial pulses down here. So when a learner, presses on them, they'll get a pulse point. And then I also have carotid pulses up here. It can also be synced up with the included blood pressure cuff. So if you wanted to have atypical blood pressure findings on your standardized patients, you can do that as well.
And we got two questions. One is about teamwork. We have some very exciting announcements on that, and in the next couple of months, the PCS products are going to gain some really amazing multiplayer capabilities, but I wouldn't like to go much deeper on that. For the time being, all I can say that nothing stops a group of learners to use Alex together or to use a Spark on-screen simulation together. But at this time, they are evaluated as a single group, and self-assessment is calculated for the entire group's performance as opposed to individuals. Also, can this be a solution for OSCEs? I would say that for certain elements of an OSCE, this can be a solution for. OSCEs are still extremely valuable and meaningful. As I said, humans cannot be replaced by AI anywhere in the near future. But for practice opportunities and also for practice for an OSCE, this is a great solution. And also, if your option is or if your alternative is no OSCE versus doing something with digital patients, obviously giving your learners some kind of a practice opportunity is better than nothing. Question about male, female, or different body sizes. For the virtual digital patients, that's easy to do, much easier. And actually, we have now eight different avatars, ranging different age groups, different ethnicities, different body size types, and even we have two different pediatric patients. Actually, one of the most exciting things that one of our pediatric patients, the 8-year-old girl, is presented together with her mom, and some of the questions are answered by mom, some of the questions are answered by the kiddo. So that really enables us to get the most out of this multi-platform content when presented in a digital patient form.
And I don't know too, maybe if Elizabeth's question was also for different body types for the PCS Plus shirt, it is made out of a stretchy material, and we also do have two different sizes available for it.
Regarding the location of the PCS Cloud, it is currently US-based. We are definitely open to having the similar functionality hosted in Europe, as we are legally required for customers, but as of today, all the data resides within the United States. will you share a recording of this session when it's over? As for all SSI's learning labs, yes, a recording is going to be shared with all participants. When you say VR, okay, are you referring to computer-generated patient? Yes. So the on-screen simulation that you have seen, well, it was much easier to share with a simple screen share, but it is also available and accessible using head-mounted displays and using Oculus hardware. So that is a possibility. One can use more immersive experiences there. Yes, just like access to simulation center in the current pandemic, because we have questions on that, has been lower lately than before. The challenges of using a headset and having it sterilized, if the headset is hosted at a simulation center, are very similar to the challenges of using mannequin-based simulation. So that's why we see much of the simulation transitioning to screen-based, bring your own device or use your own device from a distance kind of sessions. Having said that, especially with the huge increase of market penetration on Oculus Quest and other similar headsets, we start to see more and more of the learners to have their own device. So they don't really need to depend on the institution providing headsets for them. And that's a possibility. They can just access PCS Park in VR with their own devices. And we have the URL posted in chat where we will see the recording later on. We have a question about the natural learning processing interface and process, language processing. So basically, we had a more in-depth presentation around that earlier, and that learning lab is also available from as a recording from the previously mentioned URL. What I would like to really briefly mention on that is that essentially there are three key elements to that. There is speech recognition, transcribing what was asked. That transcription is used by a PCS-specific, pretty complex neural network-based classifier that is trying to identify. First, this is processing the question and cuts off any parts that are not absolutely critical for classifying it, and then it classifies within those 30,000 different topics which one it is more similar to. So what are we most likely talking about? And if it's sufficiently confident about its findings, then we use speech synthesis to synthesize the response. Happy to talk more about that. Please reach out to us after the presentation in a quick email, and we will be happy to go into more detail. Mannequin-wise, as of today, we only have Alex, the full-body adult mannequin, on the platform. What alternatives we can have is we can place a wearable simulator on pretty much any mannequin, small, big, or obese, or any kind of setup, or we can move all this into the digital realm and have enjoy the enhanced capabilities of talking and moving digital patients. Is there a drug interaction component? What is the right way to answer that? Yes, coming very soon. So we're really excited about the holidays this year. Alex does not have, actually its chest is moving. So yes, it has an automatically rising chest, and it does have haptic pulses all around its body that are uniquely electrically powered, so new pneumatics involved, much more reliable. Is there a way to address relationship development in the interview simulation? Oh yes, that's also an interesting topic that we didn't have too much time for. So in the responses as they are defined, you can go beyond just mere textual responses, and you can include and time within the response, facial expressions and gestures. Because we want to provide identical experiences to all learners, the responses are actually predefined. So there are many, many ways to ask pretty much the same question, and it's super flexible in that regard, but students will get the same response unless you explicitly program otherwise and you instruct the system to choose from a random option from multiple possible response choices, which can all include facial expression, gestures, and other nonverbal cues. Can multiple learners gather for a common simulation experience from various remote locations? Yes, I would say that's the right answer to that. For the digital patient, yeah, they can definitely do that. We started to use Alex in our nursing program and are finding that the more we use him, the more complex his communication gets. That's a very fair statement. That's exactly how Alex is learning. There are some semi-automated and some manual elements to the learning process. And also the other nice thing about the multimodal platform, that all the learning that the AI learns from, not only from your Alex session, but from all the Alex sessions in the world, the capabilities of the AI improve, and those improved capabilities are delivered then over as digital patient as well. So yeah, machine learning is definitely exciting. He behaves now. Well, yeah, he is trying. He is trying. Thank you very much. And actually, for some patients, you actually want to program the patient to use profanity and to be, irritated. That's part of a certain scenario that we bundle with Alex, actually, I believe. Yep. Tours. We don't do tours per se, but rather we are doing remote demos, and we are even doing demos when we ship a unit to our potential clients, and they can use it for a couple days on their own after just enjoying a little bit of a guided tour. Is there a military combat wound injury diagnostic component? The best way to approach as of today would be using an existing combat wound injury simulator and using the PCS Plus shirt on top of it. And when it's combined with PCS Spark, it gains all the communication capabilities, and you can use the right trauma simulator that you already have and are familiar with. So it's a combination of systems that can give you that functionality. And that's the nice thing about the flexibility of a wearable simulator, that you can put in a trauma sim. All right. I thank you very much for all the questions. I encourage you to check out our website, super simple URL to remember, pcs.ai. And you will find contact information there, and you can reach out to us. Once again, pcs.ai is the web address. And we would be happy to answer any further questions and show you more of the product functionality. We really had to limit ourselves to a high level portability and accessibility demonstration here for this 50 or 55-minute presentation. And thanks again for joining us today. And we look forward to showing you more how you can safely and more accessibly communicate and simulate with your learners.
Thanks, everyone.
Thank you.